The OPTEASE filter can be safely retrieved up to 23 days using an endovascular snaring technique. Please refer to the instructions for use for the clinical experience data and relevant retrieval time periods. The OPTEASE filter is considered a permanent filter if it is not retrieved within a clinically suitable time period. The Cordis OPTEASE retrieval catheter is an 80 cm long, 10 French catheter with radiopaque tip. It is intended for the percutaneous removal of the Cordis OPTEASE vena cava filter from the inferior vena cava within the recommended time period. Also approved as a retrieval catheter for the OPTEASE filter retrieval is the Vista Bright Tip guiding catheter. Please refer to the instructions for use for additional information. Retrieval of the OPTEASE filter is from femoral venous access only. Please refer to the essential prescribed information portion of this CD or the OPTEASE retrieval catheter instructions for use for recommended accessories. Prior to commencing the retrieval procedure, determine that the retrieval route is free of thrombus. Verify the duration of the OPTEASE filter implantation. OPTEASE filter can be safely retrieved up to 23 days. Gain percutaneous access to the femoral vein using a 10 French catheter sheath introducer, CSI. Insert the guide wire through the CSI and advance it so that it is just caudal to but not into the OPTEASE filter. Introduce and advance the OPTEASE retrieval catheter or the Vista Bright Tip guiding catheter such that the tip of the OPTEASE retrieval catheter is located at a short distance, approximately 3 centimeters, caudal of the OPTEASE filter retrieval hook. Remove the guide wire. Insert and advance the gooseneck snare or end snare through the OPTEASE retrieval catheter until it protrudes out of the OPTEASE retrieval catheter such that the marker band of the snare catheter is caudal of the filter retrieval hook. Both the MD Tech end snare and the EV3 gooseneck snare kits are approved snare devices. Please refer to the instructions for use for additional information. Push the snare catheter forward gently to open the snare loop caudal of the OPTEASE retrieval filter retrieval hook. Slowly advance the snare over the OPTEASE filter apex. Reduce the loop diameter by advancing the snare catheter while simultaneously pulling backwards on the snare until the loop engages the filter retrieval hook. Ensure that the loop of the snare has properly engaged the retrieval hook and that the retrieval hook, retrieval catheter, and snare are aligned. The marker tip of the snare catheter must be caudal to the filter hook. There must be a clear distance between the marker tip of the snare catheter and the OPTEASE filter retrieval hook. This is an incorrect alignment. This is the correct alignment. While keeping tension on the snare, hold the retrieval catheter stationary and withdraw the filter into the retrieval catheter by retracting the endovascular snare. Continue retracting the snare until the filter is completely collapsed inside the retrieval catheter. Once the filter is fully collapsed inside the OPTEASE retrieval catheter, retract the complete system as a unit out through the 10 French catheter.